All right, let's move on to this now. The health department has revealed that one person has died from the Mpox virus in South Africa. 5 cases in total have been recorded in parts of the country. This is in a space of a month. Let's speak about this now, and we are joined by the National Institute for Communicable Diseases. A specialist there is Dr. Lucille Blumberg. Dr. Blumberg, thank you so much for your time. Let's start with the Mpox virus. What is it exactly, and how easily is it spread among humans?
So, good evening, everybody. So, Mpox disease is caused, as you mentioned, by the Mpox virus. It's circulated for a long time in Africa, and in the last 3 years, it's appeared in many other countries outside the endemic areas. It's not easily spread, but it tends to occur in people who have intimate sexual contact with those who are infected.
Yeah.
And that's really the main route of transmission.
I listened to the Minister of Health quite closely, and he seemed to repeat what was initially said when the Mpox virus first hit South Africa earlier this year. And he said it mostly appears to be circulating between men who have sex with men. Is that how this is transmitted? And is that the gender in which it seems to be circulating at the moment?
So most of the outbreaks outside of the endemic areas, that is correct. The majority of patients are men, and many of those are men who have sex with men. That's correct.
Yeah. And what could have led to it taking the life of one of the sufferers? This is the 37-year-old man who died at the Tembisa Hospital in Gauteng on Monday.
So the majority of cases have uncomplicated infections with really just mild skin involvement. A smaller number will have more severe skin involvement, and then a very small number will have complications. And I think you have to look at some of the underlying factors in a number of patients. They're immune suppressed from other infections, and I think Mpox in these cases may be more extensive, but you have to consider other causes of complications in these patients. It's usually related to, or often related to, an underlying immune deficiency.
Yeah, and I also listened quite carefully to the health official who was addressing alongside the Minister of Health today, who seemed to be suggesting that the victim may have been suffering from HIV, and went further to urge people to go and test so that they know their status, so that they are able to get the necessary treatment. Could that have been the probable cause for the death?
I'm not going to comment on any individual patients. I think it's important for anyone in this group to be tested for HIV, and also to look for other sexually transmitted infections. You know, I think these do go often together,
Yeah.
and all require management.
Is the general understanding, therefore, that if you are immunocompromised, you should take greater care? Would that be the overriding statement here, without really getting into deeper connotations?
I think everybody should take great care.
Yeah.
And, you know, I think it's direct contact with people who've got often skin lesions, and that's the major route of transmission. And, you know, I think that's something to be remembered and behavioral issues and modifying one's behavior.
Yeah.
So it's really direct contact that is the major route.
Dr. Blumberg, you speak about skin lesions or skin involvement in your earlier comment. People are going to be quite worried now and possibly get hypervigilant. When you talk about skin involvement, how does this manifest on your body? And what should make you worry and actually want to seek medical help?
So the skin lesions, they can be few in number, they can be many in number. And obviously there's a differential diagnosis and causes of, many skin conditions. So it's not always easy to diagnose, self-diagnose based on what you see. So there are little red bumps, often with a lymphadenopathy, but essentially you get blistering lesions that will evolve over time and they will crust and eventually the crust will fall off. So, I think if you have an unexplained blistering lesion and you may have participated in some activities that might predispose you to those, then I think you definitely need to get checked. Not all of them will be Mpox. There's a differential diagnosis, and laboratory testing is obviously important in patients in whom you suspect Mpox, but it could be something else.
Yeah. Here's another crucial question, Doctor. Do you think that there needs to be education, or is there enough education being done to avoid the stigma that normally comes with the onset of infections like these ones? Because here now, you and I have agreed on an earlier question that this virus appears to be circulating among men who have sex with men. And with that, there is going to be questions of a particular grouping being isolated by society. What kind of education needs to go into this?
Absolutely, couldn't agree with you more. And stigma is a major issue around Mpox. It's been around HIV, and I think it's an important issue to address. I think there are obviously people who may not present to a health facility because they're afraid of the stigma. Many of the cases are mild. I think there's some communication between various groups, and for these patients, they're not going to report. Yeah. But the more severe ones do need, diagnosis and access to some particular treatment. But yes, absolutely, education of everybody, different risk groups to modify behavior, and of health professionals as well, so that they recognize these infections and manage them correctly.
Should we be concerned, Dr. Blumberg, that the patients we have in South Africa, I think the total is 5, these are people who have not had a previous history of traveling outside the country? You'll correct me if I'm wrong. And if that is the case, how then did this virus get to our shores in the first place?
I think it is circulating locally. We did have cases in 2022 as part of the global outbreak, and perhaps there was a reduction, perhaps people modified some behavior, but it's circulating locally. So I think it's here. We don't know. What we're seeing is probably just part of the whole picture. I'm sure there are many cases out there. We don't know where they've traveled, but it's circulating locally. Yeah. And I think we need to be aware of that and respond to that.
A final question to you. This Mpox virus, it appears to be on the rise in countries such as Australia. In your view, what is or what has caused the onset of this virus? Because I think earlier you mentioned, I think the country Congo is where this virus predominantly was or has been circulating over the years, but now it seems to be, spreading to other countries. What is propelling it, if I were to put it like that?
So, originally there were two different areas affected. One was Central Africa, mainly the DRC, and then West Africa, including a number of countries. And the viruses are slightly different. And it's probably from West Africa that it spread to other countries in the West, and then, globally, to be honest. Remember, we had the public health emergency in response to that.
Yeah.
And then I think in response to modifications of behavior, vaccines that were introduced, the number of cases went down. But now they are resurging in many parts of the world, including Australia, from what I've heard. And there is a concerning outbreak, a slightly different outbreak in the DRC now. So we need to ensure that we understand, what's happening and that we respond appropriately. There are vaccines and there are treatment modalities, and these need to be made available, particularly in Africa.
Final word of caution and advice to the general public on how to care for yourself in order that you don't get infected?
So I think the general public, the risk is low. I think it's related to intimate contact with at-risk groups, multiple sexual partners. And I think it's about behavior changes and being aware of what is happening now, and to note that well.
Dr. Lucille Blumberg from the NICD, thank you very much for your time.